My name is Michael McDermott. I'm a neurosurgeon at Baptist Health, South Florida, Miami Neuroscience Institute, and I'm here today with John Candela, our image-guided consultant. In this episode of Connectome of the Week, we're going to be looking at a right parietal occipital tumor that we planned for a surgical open approach, avoiding the ventral association networks and avoiding the medially displaced visual fiber tract pathways. Can you bring up for me the tracks first, and then let's have a look at sensory motor networks, ventral attention network, and visual system, please. Optic radiations, correct. Corticospinal, all right. And then let's rotate the 3D object to look at the functional networks in the right parietal occipital region. More posterior. So this patient had a MR scan without contrast for this study because of impaired renal function. Okay, rotate around posteriorly. All right, John, you can remove the parcellations now for the functional networks. And then I want to look specifically at the visual fiber pathways now on the right-hand side. Go to the axial image as opposed to the 3D image. Mag it up. Good. Now can we scroll from inferior to superior on the axial image set? Good. Slow down there. So I can see that the visual fiber pathways are anatomically intact in spite of the fact that this patient has left-sided visual field inattention. So presumably some of his visual inattention relates to the presence of the tumor and surrounding edema, which extends out to the region of the cortex. So John, if you could just scroll down, I can see the tumor there. Can you turn on the parcellations again for that region so I can see the not only the occipital radiations, but I need to see the parcellations for the ventral attention network. So if you can go to networks. Okay, show me the ventral attention network, please. Good, so scroll down. So now I'm seeing the ventral attention network of the visual cortex, and I can see that it's out lateral, and I can see the visual fiber pathways medially, and I have a window at a 45-degree angle between the interhemispheric fissure and the lateral temporal cortex where I can approach the tumor without interfering with the ventral attention network. So presumably some of this patient's clinical deficit is related to dysfunction of that ventral attention network, and we won't harm it by picking the appropriate trajectory in this case. Okay, so I think I'm ready to go. We'll export this information to our image-guided system and then plan the patient in the left semilateral position with the right parietal occipital region the highest up in the surgical field. We'll use image guidance to select the trajectory to the target and then proceed with surgery. Thank you, John.